Welcome to Pharmoon Drops. Clofazimine is an anti-leprotic drug which shows anti-inflammatory action. Clofazimine shows two activities. One is anti-leprotic activity. Second one is anti-inflammatory activity. Similarly, the anti-leprotic drug dapsone also shows anti-inflammatory activity. The anti-leprotic drug dapsone shows anti-inflammatory property. Out of this, the anti-inflammatory activity of clofazimine is very useful for treating Lepre reaction. The anti-inflammatory property of clofazimine is very important because this property is useful in the treatment of Lepre reaction. Lepre reaction is a condition which appears in patients with leprosy. Lepre reaction appears in patients with leprosy disease. This Lepre reaction is the immediate and severe appearance of symptoms. Lepre reaction is the sudden appearance of severe symptoms. The symptoms may include enlargement of existing lesion, swelling of lesions, appearance of redness at lesions, and the development of pain. The symptoms of Lepre reaction are enlargement of lesions, redness of lesions, swelling of lesions, and pain at the lesions. Several new lesions may also appear. Along with this, the patient feels fever and weakness. Clofazimine is useful for treating the Lepre reaction which appears in leprosy patient. Clofazimine is useful in treating the Lepre reaction which appears in leprosy patient. This is due to the anti-inflammatory property of clofazimine. The daily dose of clofazimine for treating Lepre reaction is 200 mg. 200 mg of clofazimine can be administered for treating Lepre reaction. Acid insoluble ash value is a limit test which is used to detect siliceous impurity. Siliceous impurity can be tested by using acid insoluble ash value. Actually, this test is a limit test. Acid insoluble ash value determination is a limit test. Total ash value is the percentage of ash formed when a crude drug is incinerated. That is, total ash is the percentage of ash with reference to the air-dried crude drug when that crude drug is incinerated. Total ash value has a disadvantage. It cannot detect the soil present in the crude drug. Total ash value test cannot detect the soil content of the drug. This can be overcome by testing acid insoluble ash. This can be overcome by testing acid insoluble ash. This is the portion of total ash which is insoluble in acid. The portion of total ash which is insoluble in acid can be called as acid insoluble ash, and the percentage of acid insoluble ash can be called as acid insoluble ash value. The percentage of acid insoluble ash can be called as acid insoluble ash value. The limit test for soil can be done by using acid insoluble ash value. Using acid insoluble ash value, the limit test for soil can be done. Silica is a major constituent of soil. The impurity present as silica can be called as siliceous impurity. The impurity present as silica can be called as siliceous impurity. Acid insoluble ash value is a limit test for siliceous impurity. Acid insoluble ash value is a limit test for siliceous impurity. 11.5 normal hydrochloric acid is used for detecting acid insoluble ash value. 11.5 normal hydrochloric acid is used for detecting acid insoluble ash value. The cultivation of opium poppy and the production of opium are to be supervised by the narcotic inspector. The narcotic inspector is authorized to supervise the cultivation of opium poppy and the production of opium. The provisions related to the cultivation of opium poppy and the production of opium are stated in the Narcotic Drugs and Psychotropic Substances Act 1985. The Narcotic Drugs and Psychotropic Substances Act 1985 gives the provisions related to the cultivation of opium poppy and the production of opium. Measles, typhoid, Japanese encephalitis are diseases which can be prevented by vaccination. Measles, typhoid, Japanese encephalitis are diseases that can be prevented by using vaccines. AIDS is a disease which is not preventable by using vaccines. AIDS cannot be prevented by using vaccines, out of which measles is caused by virus. Name of the virus is measles virus. Measles is caused by the virus known as measles virus. Measles can be prevented by administering measles, mumps, rubella vaccine, that is MMR vaccine. MMR vaccine, that is vaccine against measles, mumps and rubella. This vaccine can prevent 3 diseases, that is measles, mumps and rubella. MMR vaccine can prevent 3 diseases, which are measles, mumps and rubella. Mumps is caused by paramyxovirus. Paramyxovirus causes mumps. Mumps is otherwise known as German measles. German measles is otherwise known as mumps. Rubella is caused by rubella virus. Rubella virus causes the disease rubella. Typhoid is caused by a bacteria known as Salmonella typhi. Salmonella typhi causes the disease typhoid. 2 vaccines are available against typhoid. First one is inactivated or killed vaccine, and the second one is live attenuated vaccine. Inactivated or killed vaccine and live attenuated vaccine. These are the 2 types of vaccines against typhoid. The inactivated or killed vaccine can be administered as injection, and the live attenuated vaccine can be administered orally. Inactivated or killed vaccine can be administered as injection, and live attenuated vaccine can be administered orally. Japanese encephalitis is caused by flavivirus. Flavivirus causes Japanese encephalitis. Japanese encephalitis is a disease spread by mosquitoes. Mosquitoes cause spreading of the disease Japanese encephalitis. Erythromycin, roxithromycin and clarithromycin are macrolide antibiotics. Erythromycin, roxithromycin and clarithromycin are macrolide antibiotic. Terramycin is not a macrolide antibiotic. Terramycin, that is TERRAMYCIN. Terramycin is not a macrolide antibiotic. Terramycin is a brand name. Terramycin is a brand name, and the content of terramycin is oxytetracycline. The chemical content of terramycin is oxytetracycline. That means terramycin comes under the class tetracycline antibiotic. Terramycin comes under tetracycline antibiotics.